Welcome to Medicomp. We have been advancing diagnostic cardiology since 1981. Medicomp presents a patient guide for the CardioPAL SAVI event monitor. Your doctor has prescribed this event monitoring procedure and entrusted Medicomp to help identify any possible cardiac arrhythmias. The CardioPAL SAVI you will be using is equipped with artificial intelligence that will automatically capture cardiac events even if you don't feel them. That means you can rest assured you'll be getting accurate test results in a short amount of time, allowing for quicker diagnosis and treatment. Your doctor's office may have given you a brief tutorial on the event monitoring procedure, but this video provides all the information you'll need for proper use and handling of the monitor during your testing period. Please note all this information is also available in the patient guide located in your SAVI kit and can be reviewed. Also in the kit, you'll find the following items: SAVI monitor, patient cable, electrodes, AA batteries, lanyard, patient survey, and a prepaid shipping envelope. Event monitoring, how the process works. When you feel a symptom, the SAVI monitor will allow you to record your own electrocardiogram, also known as an ECG, and transmit it from most landline telephones to Medicomp's Cardiac Monitoring Center, anytime 24 hours a day, 7 days a week. Our team of cardiac specialists is on hand to receive and review your ECG strips and forward a report to your doctor. Your doctor's office may have hooked you up to the monitor, but let's take a moment to review the process. The center of the patch should be within the areas indicated by the boxes. The number of electrodes you are wearing may vary from those shown. Before applying the electrode patches, follow steps 1 through 3 on how to prepare your skin. Step 1. Choose areas of your chest that are flat and not very muscular. Avoid skin folds or creases, irritated skin, or scar tissue. Step 2. Wash each site thoroughly with plain soap and water. Do not use soap that contains lotion or oil. Step 3. If necessary, shave hairy areas using an electrode as a guide for the size of the area to shave. This ensures good contact and makes electrode removal much easier. Applying the electrode patches. Find the patient cable. Snap the wires onto the electrodes and peel the white electrode from the plastic backing. And using the illustration in the patient guide, apply it to your chest. Remember, white on right. Repeat the process for the green and red electrodes. We recommend that you change your electrodes every 2 days, moving their location slightly to prevent skin irritation. If your SAVI monitor was not set up at your doctor's office, you'll need to insert a battery in the monitor at this point. The location of the battery compartment depends on the model of the monitor you have. Both models only operate on one AA alkaline battery. During your procedure, the monitor will alert you when the battery needs to be changed. On the side location model, slide the latch in the direction of the embossed arrow to unlock the battery door. Tilt the monitor so that the old battery slides out. Insert the new battery using the label on the back as your guide. To close the battery door, ensure the latch remains in the out position. Close the door and push the latch back to the locked position. For the rear location model, slide the battery door in the direction of the embossed arrow to remove the battery. Use the ribbon attached if needed. Insert a new battery using the picture inside the compartment as your guide. Align the cover to the compartment and slide the door back into position. Plug the connector that joins the wires into the SAVI monitor. The unit will turn on and run through a series of self-checks and ask you some questions that require a yes or no response. Set up auto looper. Press yes. Time zone OK. Press no to get to the correct time zone. Then press yes to confirm. Pacemaker option off. If you do not have a pacemaker, press yes. Auto looper settings OK. Press Yes. The monitor will then check the placement of your electrodes and provide any necessary corrective actions. In the unlikely event you experience setup problems, allow the electrodes to stay on your skin for an additional 10 to 15 minutes and try again. If that doesn't resolve the problem, call Medicomp's Cardiac Monitoring Center toll-free at 1-877-996-5553. Once the initial setup is complete, the monitor will automatically begin to monitor your ECG, and its display should show monitoring with the current date and time. It is important that you keep the Savi hooked up to you at all times. Wear the Savi monitor where it is most convenient, on your waist using the belt clip, in a readily accessible pocket, or around your neck using the lanyard provided. And be sure the symptom button is easily and quickly accessible. Please do not use the lanyard while sleeping or operating machinery. A note of caution. The Savi should be worn outside your clothing if there is any chance that perspiration might come in contact with the unit. The unit should be worn under outerwear, such as raincoats or jackets, for protection during wet or cold conditions. While you have the monitor with you, if at any time you feel any symptom you think may be related to your heart, press the symptom button. When you press the symptom button, the monitor saves your heart's ECG activity that occurred about a minute before you press the button, and then continues to save the ECG for about 30 seconds after the button was pressed. And this can be very important because the cardiac event can occur before you feel any symptoms. This means that your physician can see what was happening with your heart before you had the symptom. In addition, the Savi's unique auto capture capability may also detect ECG abnormalities that you don't feel. This is why it is very important to wear the monitor with the electrode patches whenever possible. When you do feel a symptom, press and release the symptom button. Listen for a beep, indicating that the recording has begun. The unit's display shows a countdown message, so you'll be able to tell how long the recording will take. Limit your movements and breathe normally. Wait until the Savi emits a second beep and displays "Recording complete" before moving around freely again. The monitor can hold multiple recordings, but it is best to try and transmit your ECG after each recording. To transmit your ECG recording, call Medicomp's Cardiac Monitoring Center toll-free. The number is conveniently located on the bottom of the monitor. Before you begin your transmission, give the technician your name, city, and any symptoms that you felt while making the recording.
Hello, I need to transmit a recording.
Yes, what's your last name, please? Jones, and your first name?
Peter.
Peter? What city do you live in?
Chicago.
Chicago. Okay, I have your information here. What kind of symptoms were you having?
My heart felt like it was beating fast.
Okay, your heart was beating fast. And what were you doing at the time?
I was just watching television.
Just watching TV? Okay, whenever you're ready, unplug the cable from the back of the monitor. That's correct. Right. Lay the mouthpiece of the phone to the back of the monitor where the speaker is, and then just press the yes button.
In order for your doctor to receive the best transmission, please do not use cell phones or cordless phones. To ensure a quality transmission, please do not bump the flat surface, talk, make loud noises, or touch the monitor while the transmission is in progress. With the front of the monitor facing out, you should be able to see the progress of the transmission on the display. What does the Cardiac Monitoring Center see when you transmit? Something like this. Medicomp's policy prohibits the staff from releasing information to you about the content of your ECG recordings. However, your doctor can go over this information with you. When the tones stop, transmission is complete. Always pick up the handset and wait for further instructions from the technician at Medicomp's Cardiac Monitoring Center.
Okay, Mr. Jones, are you there? Okay, everything came through clearly. I have it here and I'll send it off to your doctor. Thank you very much.
Thank you.
Event monitors are intended for use during all of your daily activities that do not involve being in water. This includes sleep, exercise, and during periods of emotional stress. You can shower or bathe, but first remove the cable from the Savi and then unsnap the wires from your chest electrodes. You can leave the electrodes on your chest, but try to avoid applying water or soap directly to them. If, after you shower, your electrodes start to peel off, simply replace them with new ones. Here are some suggestions for wearing the monitor while sleeping. Wear the Savi on the waistband of your night clothing. Place the monitor beside you with wires extended as much as possible so that you don't roll over onto the unit. Wear a large button-down shirt with a breast pocket and place the Savi in the pocket. Whichever method works best, just be sure you can get to the symptom button in the event you experience any symptoms. Cleaning the CardioPAL SAVI. If needed, clean the monitor with alcohol prep pads or a soft cloth slightly moistened with isopropyl alcohol. Do not submerge the monitor in any liquid. If this does happen, first allow it to air dry. Then seal it in a plastic bag and ship it back to Medicomp. Medicomp will send you a replacement monitor. Returning the Savi. Once your procedure is complete, please make sure all ECG strips are transmitted to Medicomp's Cardiac Monitoring Center before returning the Savi. Remove the battery from the Savi and place the monitor in the case provided, along with the cable, patient guide, and any unused electrodes and batteries. If you have an opportunity, please fill out the patient survey provided. This helps us ensure we are always providing the highest quality service to our patients. Place the survey in the kit and the kit into the return envelope. Seal the envelope and drop it in any U.S. mailbox.